Hello, everybody. Today, we are going to be talking about the Lynparza drug, which is a targeted therapy and/or intervention associated with ovarian cancer, which is the topic that we chose for our lecture. Now, before we get started, I just want to give a brief overview of each section of the slideshow and what we'll be going over. So first, we'll have a brief introduction, including the basics of ovarian cancer and what Lynparza is as a drug, its side effects, and how it works. We'll be going over the molecular consequences, hallmarks targeted, epidemiology, which includes public health problem statistics, changes over person, place, and time, risk factors, etc. And lastly, we'll be going over the clinical research aspect, which includes clinical subtypes, clinical course, and development of targeted intervention. So now moving forward, we are going to talk about the basics of ovarian cancer. Ovarian cancer occurs when a growth of cells form in the ovaries with mutations in their DNA, and these cells replicate at an expedited rate, causing the growth of a tumor, which includes a mass of tumor cells. Germline BRCA1 and 2 mutation carriers have an increased risk of development of ovarian cancer, and these are two of the most popular mutations you'll hear about that are associated with ovarian cancer and also breast cancer. Other suppressor genes and oncogenes involved include BARD1, TP53, RAD51, PALB2, and CHEK2. Ovarian cancer, mostly it occurs in women after they've started menopause, and this is caused by inherited and acquired mutations. Inherited genetic mutations are more with women that have an increased risk due to family history. So this could include mutations in the BRCA1 and 2 genes, and also related to other family cancer syndromes. Acquired genetic changes are not inherited, but just occur during a woman's lifetime. Now we're going to talk about what Lynparza actually is. It's a non-chemotherapy oral drug that gives cancer patients an alternative option to treatment. It's used to treat fallopian tube cancer, advanced ovarian cancer, or primary peritoneal cancer with BRCA or germline gene acquired from inheritance genetically. Here are some of the side effects of Lynparza and also in detail how it actually works in the body. It prevents PARP from repairing their DNA. So you're probably wondering, what is PARP? It's a protein that helps cancer cells repair themselves when they're damaged. It also mainly works against early stage and metastatic HER2 negative breast cancer with a BRCA1 or 2 mutation by making it difficult for those cancer cells to repair. As I said before, it's a non-chemotherapy oral medication, and the recommended dosage is 300 milligrams twice a day. It's also used to treat early stage HER2 negative breast cancer, like I said before, because it has a higher rate of recurrence. Side effects, there's a lot of them. It includes nausea, vomiting, heartburn, shortness of breath, dizziness, low red and white blood cell count, urinary tract infections, headache, and abdominal pain. You're supposed to avoid grapefruit juice and Seville oranges and orange juice while taking this medication, and to not take CYP3A inhibitors, which include antifungal medications. It can also harm developing fetus in pregnancy. So when taking this drug, avoid trying to get pregnant, or you should not be pregnant while taking this drug.
So we're going to talk about the epidemiology of ovarian cancer and the details of Lynparza as a targeted therapy against it. So the public health problem statistics for ovarian cancer right now, these statistics are going to be for the United States. So the current incidence rate is about 19,710 women will receive a new diagnosis of ovarian cancer. The current mortality rate is about 13,270 women. And ovarian cancer is a disease that develops in mainly older women, most of them being above 63 years old. And it is more common in white women than Black women in the United States. And so here's an infographic of ovarian cancer and some of these rates in an infographic form. So this was actually made in 2017. And as you can see, the rate for incidence of ovarian cancer was higher. So it was about 22,280 for incidence and 14,000 for deaths. And this says about 1 in 75 women will be diagnosed with ovarian cancer during her lifetime, and 63 is the average age of diagnosis for women. And as you can see, there's a 90% survival rate for those who have stage 1 or 2 cancer, and then a 28% survival rate for those who have stage 3 or 4. And then at the bottom of this infographic, we can see there's some warning signs and risk factors and treatment, and we'll be talking about this in the next slides. So first, looking at changes over person, place, and time for ovarian cancer. Ovarian cancer diagnoses have actually been falling for the past 20 years, and the incidence rate has been declining by about 1 to 2% per year from 1990 to the mid 2010s, and by almost 3% per year from 2015 to 2019. So looking at this graphic below, you can see in the United States the difference between white women and Black women who develop ovarian cancer. So the rate per 100,000 has actually been decreasing in white women and has pretty much stayed steady, but decreased a little bit in Black women. And this is mostly because of oral contraceptives and the access to them. White women have a greater access to these oral contraceptives than Black women do. And then looking at the global picture of ovarian cancer, we can see that the highest rates are in Northern and Eastern Europe and in Southeast Asia. And this can also be due to access to oral contraceptives or also the birth rates in these countries, because getting pregnant and giving birth is actually a way to decrease risk of ovarian cancer. And we'll look at that when we go to risk factors. And then looking at incidence rates in New York, so in one steady place over time, from 1997 to 2001, we can see the age at diagnosis and the average annual cases. So we can see by age 40, pretty much, that's when the incidence rate starts increasing. We don't really see that many cases below age 30. So we can also see how this is a disease in mostly older people. And then some risk factors of ovarian cancer. The two main risk factors of ovarian cancer are having a family history of ovarian, breast, uterine, or colorectal cancer, and then having a gene mutation like BRCA1 or BRCA2. So those are going to be the two biggest risk factors of ovarian cancer. Some other factors are postmenopausal. So basically after your age of your menstrual cycle, once that stops, you are at increased risk of ovarian cancer. And that's why it's also at that increased age. And then things that decrease your risk of ovarian cancer are pregnancy, breastfeeding, and use of oral contraceptives. So we're going to look at an observational study done on the oral contraceptives and risk of breast cancer and ovarian cancer in women with a BRCA1 or BRCA2 mutation. So this was a meta-analysis. So they took both case control studies and cohort studies, put them all into one document and looked at the results. And basically the results of this study were that use of oral contraceptives lowered the risk of ovarian cancer, but increased the risk of breast cancer in women with a BRCA1 or BRCA2 mutation. And the strength of this risk factor is about 20 to 25% of women diagnosed with ovarian cancer have a family history of the disease, and inheriting that BRCA1 or BRCA2 mutation is the greatest risk of ovarian cancer. The quality findings of the study were that they were unable to adjust for some important confounders such as breastfeeding, alcohol consumption, body mass index, and physical activity, which could affect the risk of breast cancer or ovarian cancer. And the individual studies also did not report the underlying diseases or conditions of the study populations. So they weren't able to investigate for the characteristics of the subjects and if that affected the outcome of the study. So it's hard to say if these factors actually affected that risk factor or not, or affected the outcome of the study. But the usefulness for prevention, we see in the study that taking an oral contraceptive can lower risk by 33 to 59% in women who have a BRCA1 or BRCA2 mutation, and that risk factor is 0.53, and that is a significant number because 1 is not included in that study. And then looking at intervention studies for PARP inhibitors, which is what Lynparza is, this study looks at the effects of PARP inhibitors in the treatment of advanced ovarian cancer. And this again is another meta-analysis. So they took a bunch of randomized control studies and put them all together in one study. So basically they looked at 10 eligible studies comprising of 4,241 patients with advanced ovarian cancer. And they also looked at 4,553 patients for a toxicity profile. And they evaluated 10 randomized control studies conducted between 2012 and 2019 and compiled them into one research document. And basically the results for this study were that the hazard ratio was 0.41 for overall patients, 0.32 for those in a BRCA mutation setting, and 0.57 in the wild type setting. So This was between a PARP inhibitor versus a control group. So basically, we can see that using a PARP inhibitor lowers the risk of ovarian cancer in overall patients, but also in BRCA mutation settings. And the intervention usefulness, this study provided support that the use of olaparib can decrease the risk of ovarian cancer by a significant amount in patients with and without BRCA mutations. So, a risk benefit analysis, treatment showed signs of all grade and high grade side effects. And here are some of the side effects that they found, but mostly the largest side effect was nausea and anemia. So this is a graphic shown from the actual Lynparza website that shows the most adverse reactions to using Lynparza. So basically, the two largest ones were fatigue, anemia, and then also nausea was an effect that was shown. Most of these are not in grade 3 though, so they really weren't a huge effect. And they were also shown in the control group or the placebo, meaning that this could be a factor that is just um, shown as an adverse reaction to anything. And then the cost benefit analysis for Lynparza, it costs a 100 milligram tablet is around 8,374 for a supply of 60 tablets. And here is a graph showing the comparison to other treatments for ovarian cancer. So we can see that Lynparza is a bit on the pricier side, but it does have that benefit of lowering risk factor and tumor growth in those who have ovarian cancer.
This is the clinical research behind ovarian cancer and Lynparza. There are 5 clinical subtypes of ovarian cancer, including high-grade serous carcinoma, clear cell carcinoma, endometrioid carcinoma, low-grade serous carcinoma, and mucinous carcinoma. The high-grade serous carcinoma takes about 70% of all cases, and the other 4 cover about 30%. The indicators of these subtypes include lesions, syndromes, and mutations that are centered around the preliminary occurrence of these cancers themselves. It's important to note that roughly 70% of all ovarian cancers, which is the high-grade serous carcinoma in the fallopian tube epithelium, come from at least partially a BRCA1 and 2 mutation, or they exhibit a BRCA1 and 2 mutation. Possible therapeutic treatments for the other 30%, so the 4 on the right of that chart right there, is going to be treated by proliferation regulation drugs, which mess with cellular signaling and cell growth. The other 70%, which is going to be that high-grade serous carcinoma once again, is going to be controlled through PARP inhibitors like Lynparza. The clinical course of this drug, the prognosis is an average 5-year survival rate of 50.8 across all stages. The early prognosis is vital to maximize survival chance, which can be seen in the stage to 5-year survival chart to the right, which of course states that in stage 1 there's an 89% chance, 2, 71, 3, 41, and 4, 20. Propensity for metastasis. Most cases exhibit metastasis throughout the body to other necessary internal organs like the lungs or the liver. It's generally diagnosed after distant metastasis, which can be seen in the chart to the right, this pie chart. Of course, with 57% of cases being that distant metastasized cancer. Yeah. The treatment protocol for Lynparza is it's administered orally with a pill, usually in doses of 150 milligram, 2 pills of 150 milligram pills twice a day. And that usually lasts until signs of cancer progression is seen again. This is not a drug that is going to, destroy cancer or just send it all the way back to the dark ages. It's just going to kind of stop it in its place, but it's going to do that by attacking DNA repair. The clinical course and treatment of Lynparza, patient experience with Lynparza includes many different side effects, which are almost all within category 1 and 2 as far as danger for how dangerous they are. They're not really requiring much hospitalization unless I would say you are more at risk. Side effects include anemia, which happens in 48% of people in the test submitted by the company behind Lynparza. There's fatigue, which is in 30%, nausea, which is in another 30%, diarrhea, which is in 19%, decreased appetite, 16%, lymphopenia, 14%, dizziness, 14%, and abdominal pain, which is another 13%. Resistance development under Lynparza can consist of a median progression-free survival of 22 months, signifying that resistance probably occurs around the 2-year mark of treatment for a majority of patients. It is important to understand that the actual, which this will be mentioned later, but the actual range is about from 6 months to 4 years for the progression-free survival in the study, submitted by the company behind Lynparza. So patients really could expect between 6 months to 4 years of that, extra life. It occurs most frequently due to a selection of cancer cells able to circumvent apoptosis triggering events caused by the PARP inhibition. So basically what happens is enough cells are killed, they don't have the BRCA1, so they have to rely on PARP. So enough of them are able to, are killed off by the PARP inhibitors that, eventually some are able to kind of circumvent the need for PARP and also are able to kind of trick the cell cycle checkpoints into going away from worrying about an accumulation of damaged DNA. Treatment combination. Lynparza may be used in combination with chemotherapeutics like platinum-based agents such as carboplatin and taxanes such as paclitaxel. This is among others which work by targeting rapidly dividing cells, including cancer cells. Combinatory uses of these drugs function to attack the cancer cells at multiple points of the cell cycle to maximize drug efficacy. You see, at least I've seen, a few different combinations. Lynparza with the taxanes, it was the most common, it seems like, but the platinum-based agents were kind of not really seen to increase efficacy that much. But it seems like there is a few researchers who are wanting to use all three at the same time. The affected subgroups are demographics that are already immunocompromised. They might see a worsening of their condition since Lynparza's possible side effects do include immune system deficiency. Basically, any of the side effects that you kind of already exhibit, issues with, you're gonna see an increased worsening of those issues. Like acute anemia or other conditions would just intensify. The development of the targeted intervention of PARP inhibition. The logic behind PARP inhibition, comes from that 70% of ovarian carcinoma have inactive BRCA1 and 2 genes, which of course code for DNA repair enzymes. Cancer cells that exhibit mutated BRCA1 and 2 rely on secondary mechanisms for DNA repair, such as PARP enzymes. The inhibition of these secondary repair mechanisms, of course, impair tumor growth. The less DNA repair options, like BRCA1 and 2 and like the PARP, that the cancerous cells have, means that there is more accumulative DNA damage within the cell, right? That is more likely to be picked up during the cell cycle checkpoints. In these checkpoints, the cell is, attempted to trigger apoptosis, which does make this a cytotoxic drug. It contributes towards a wider therapeutic index due to healthy cells exhibiting normal BRCA1 and 2 levels, which allows them to not be as affected by Lynparza. This basically allows the drug a higher dose. You're able to give the individual a higher dose because it's less likely to have a severe effect on normal healthy cells because they have that primary DNA repair mechanism, which the cancer cells do not, which is also how it discriminates healthy and cancerous cells. Thank you.